Hey, it's Mo Egger. If you love sports, man, this is a great time of year. You've got college football, the NFL, and of course, college basketball. And there's no place to watch all the games than Long Neck Sports Grill. 3 locations in northern Kentucky, Wilder, Hebron, and Richwood. They've got 4K TVs all over the place with the sound on for all the big games. Plus, the menu is fantastic. You've got to try the wings, and no place has a better beer selection. Long Neck Sports Grill. Stay late. Come often. One thing we've done every week, it's normally been on Wednesdays, but I wasn't here yesterday, is we talk injuries mainly throughout the NFL with one of the experts at OrthoCincy. What we love about OrthoCincy is they've got specialists and locations throughout the tri-state. They've got walk-in orthopedic urgent care with evening and Saturday hours. You never need an appointment. You can learn more at OrthoCincy.com. That's OrthoCincy.com. Dr. Amelia Wiggins is with us this week. She's been on this show a bunch this season and provided great expertise. We're obviously going to talk a lot about La'el Collins. He is dealing with a tear in his ACL and a torn MCL. How much more difficult is the treatment when there are multiple tears?
Right, yeah. When you do have multiple tears there, that definitely prolongs the recovery because now you have to heal 2 injuries instead of 1. But hopefully, of course, without looking at the MRI and knowing specifically how bad the MCL is torn, hopefully he can avoid any intervention to the MCL. Typically, the MCL heals on its own, so you don't need additional surgical repairs for the MCL. So hopefully he gets in there, and is just able to have an ACL reconstruction. Hopefully the meniscus and the cartilage all looks good. And then hopefully that MCL isn't too severe and that one will just heal on its own. So in the grand scheme of things, it shouldn't set him back too much. It's still, we know from Joe Burrow, ACL injuries take 9 months to a year even to get back. So he's got a long road ahead of him, but the MCL hopefully shouldn't set him back too much.
I know every person is different. Joe Burrow suffered his injury in late November, and he was on the field for week 1 the following season. Could we expect something similar? La'el Collins obviously getting injured in the calendar about a month later, but is it unreasonable to think that he can be back on the field for week 1 next season?
I think maybe, yeah, maybe that's not unreasonable. Or maybe just even, week 3 or 4, if he misses just the first couple games to make sure he's back 100%. I think we would all rather him come back 100% than, to limp through the first few games and potentially, compromise the season. So
he has a pretty significant injury history. He had a back issue that kept him out of a large chunk of training camp. He's had a hip problem before. He's had a history of an ankle issue. So, I mean, the list is growing long, unfortunately. How much could any of that complicate his long-term prognosis?
I know, and I think we talked about this the first time we met, that some people are just prone to these injuries. What is happening? But it's also, he's got a hard job. He's a big guy. He's got a hard job. He takes a lot of hits. So hopefully, actually, with this rehab time for his knee, hopefully his hip and his back and his ankle, those will have time to recuperate as well. And his therapist will work with him on all of those aspects. This is a full body recovery after an ACL surgery. So hopefully he'll come back better than ever. But, he's a professional athlete. He's got a hard job. He's definitely going to have some effects long-term on that body.
When the injury first occurred, there was a wave of relief because the reports were the initial on-field ligament test. He passed it, and the prognosis was he's going to be okay. It looks like a knee dislocation. This is not a tear. This isn't worst case. And then after the fact, we find out that he has 2 tears. How does something like that happen?
Gosh, that's so hard. So when a player goes down, we rush out, we try to get that good initial first exam, but there's a lot that plays into that. The athlete is in pain, there's a lot of people around. This is a very stressful, high energy situation. And when we do the test to test the ACL, what we do is we try to see how far the shin bone moves forward from the femur bone, because the ACL attaches your thigh bone to your shin bone there. And so if your ACL is tight, then there won't be any movement, or there will be very little movement between those 2 bones. If the ACL is lax, then we see a lot more translation. We see that tibia slides forward, and you can typically feel that. But if the patient is in shock, if they're seizing up, if they're kind of going, oh, they're too tight, if that hamstring contracts, then you might not get that laxity that you think. So then you think you have a normal test. It's really their hamstrings that's pulling back, guarding, against this injury. The hamstring contracts and says, whoa, something's happened to the knee. I'm going to be really tight. And then you can't assess that ACL really good. So then, we get the patients into the exam room, into the training room, calm the situation down, get the player to relax. Then you can get a better exam on that ligament and see, really what's happened.
Yeah, going to be one of the major storylines when we get to the offseason, Lyle Collins, recovery, his rehab, and ideally him being back on the field next year. I want to ask you about another player who doesn't play for the Bengals, but, tangentially, he is kind of connected to Cincinnati because Joe Burrow's in the MVP race. Jalen Hurts of the Philadelphia Eagles is in the MVP race. He didn't play this past week. He's got a shoulder sprain. He wants to play this week. I guess two-part question. A, how much could he be compromised when he does get back on the field, whenever that is, if he's still dealing with this? And what factors go into determining whether he'll be able to play?
Right, I know. So from what I understand, he has an SC sprain. So typically we hear football players have AC sprains, that acromioclavicular ligament on the more outside of the shoulder, where he injured the SC, the sternoclavicular joint. So that's where your clavicle attaches to your sternum. So that's basically the point where your shoulder attaches to your body. Those are not very common, a little bit more common in football players, but not very common in general. And those can range, from mild to severe. I'm sure he has a mild one since he's actually hoping to play. So really, 2-3 weeks off, I think he should be back good to go. The complicating thing for him is that he obviously wants to get back and get his final wins so they can be the first seed to hopefully get the bye week, so he can really have a chance to recover. So I think ideally if they could, win without him, then that would give him a few extra weeks to lead them into the playoff season. But I think he would be okay. If he thinks he's ready to play, the therapist will run him through tests, the doctors will run him through functional tests. If his strength is back, if his accuracy is back and his power, I think he should be fine to get out there and play, and then hopefully get that bye week and have a couple more weeks to get this behind him.
Tremendous insight as always. Happy New Year. I know you're going to the game on Monday. Enjoy, and we'll talk soon. Thanks so much.
Absolutely. Thank you. Happy New Year.
Happy New Year to you, Dr. Amelia Wiggins from OrthoCincy. I say this all the time. The great thing about the people at OrthoCincy, specialists and locations all across the tri-state, including walk-in orthopedic urgent care with evening and Saturday hours at the Edgewood and Eastgate locations. Definitely easier and certainly cheaper than going to an ER when you have an urgent orthopedic injury. Go to OrthoCincy.com. That's OrthoCincy.com. Hey, it's Mo Egger. If you love sports, man, this is a great time of year. You've got college football, the NFL, and of course, college basketball. And there's no place to watch all the games than Long Neck Sports Grill. 3 locations in northern Kentucky, Wilder, Hebron, and Richwood. They've got 4K TVs all over the place with the sound on for all the big games. Plus, the menu is fantastic. You've got to try the wings, and no place has a better beer selection. Long Neck Sports Grill. Stay late. Come often.